Now recording in progress. The main structure which is affected by burn is the skin, and that is why it is very important to start knowing something about the skin. The skin consists of two layers. The outer layer of the skin is called the epidermis, and the inner layer is called the dermis. So the outer layer, it does not contain any blood vessels or nerve endings. It's just, form a port for the passage of hair follicles and hair and the pores of sweat glands, and also acts as a sensory structure through which we feel the sensation, different types of sensation like pain. I just want you to concentrate on the dermis, which is, it consists of two parts. The first part is the papillary dermis, and the papillary dermis is just the papillary dermis is a layer, is the outer layer of the dermis, which looks like papilla. Papilla means finger-like structures, and this one, I don't know, I just want to see the pointer. Where is the pointer? Yes, this is a pointer. So this is the papillary dermis. It is formed in the form of this papillae, like this. And as you can see, it contains many things. Among the things which it contains is the capillaries of the skin and the free nerve endings. And then you have the inner layer of the dermis, which is the reticular dermis. This is very important because in order to understand the process of burn, we have to know the skin structure, especially about the dermis, because it helps us a lot in understanding the pathogenesis of burn. It takes a long time. I don't know why to just convert the slide. Yeah, and this is what I have just mentioned. The epidermis, there is no blood vessels, and the dermis consists of papillary dermis and reticular dermis. Contains this. The dermis contains the blood capillaries and connective tissue, elastic fibers, collagen, fibroblasts, mast cells, nerve endings, and lymphatics and epidermal appendages like the glands of the sweat and the sebaceous glands. So what is the function of the skin? The skin, the primary function of the skin is protection. It protects us against, environmental adverse conditions, like, for example, cold weather, hotness, and also it forms, a barrier to microorganisms. Microorganisms cannot go inside our body because the skin is going to protect us. It acts, as a thermoregulatory organ because it contains the skin, the sweat glands, and the sweat glands, plays a big role in the thermoregulation of the body. And also, it helps to maintain fluid and electrolyte because if there is any loss of skin, the fluid in our body tend to evaporate, and so we are going to lose fluid. And vitamin D synthesis is manufactured. There is a certain step in the synthesis of vitamin D, which takes place in the skin. So that is why it is very important. In addition, the sensation and also psychosocial, you know, uh, aspect of the skin color matters, a lot of things which are, you know, related to psychosocial characteristic of the skin, which are very important. طيب, we just skip this part اللي هو wound healing. This is not part of the objective of this lecture. You can just go on it to help you understand the process of burns. This slide is not among the objectives of I mean your lecture, but it's going to help you to understand the process of burns, because it's all about healing. Okay, you just go through it. It's very important to see and understand. طيب, and this also you know, part of the process of healing, the types of wound healing, because we have two types of wound healing. The first type of wound healing is healing by primary intention, and we have or first intention, and then the healing by secondary intention. And usually when we talk about burns, we talk about secondary intention. Secondary intention means there is loss of skin, because as most of the time in burn, you know, trauma means there is loss of skin. Right. What are the factors which affect wound healing? Of course, you know, this is ischemia, infection, foreign body, edema, elevated tissue pressure, mechanical injury, and you have the systemic factors that include age, stress, ischemia, diseases, obesity, medication, alcoholism, and smoking. And in immunocompromised conditions, patients are affected by this, you know, have got adverse effect on the healing process, and of course nutrition, and some other drugs which are like steroids, which are going to delay the healing process. Now, we go further, you go also through this. This is complication of wound healing, because the burn, any process of burn is ultimately going to end up in healing. So what are the complications of healing? Complications of healing include like this hypertrophic scarring. That means it forms some disfigurement, and keloid formation. Keloid means, you know, this is the scar, overgrowth of the healing scar beyond the limits of the wound. Okay, we'll show some pictures of this, what we mean by keloid, and also necrosis of structures. Also, we are going to show pictures. Inflammatory infiltration, because this is a traumatic process. It includes, you know, part of the healing process is inflammation, abscess formation, foreign body containing abscess, and what is called as marginal ulcers, here chronic burn ulcers. Marginal ulcers means the development of malignancy in a burn ulcer. طيب, what is the definition of burn? Burn defined as coagulative necrosis of tissues due to physical, chemical, and electrical agents. Okay, coagulative necrosis, because you know that we have in pathology, maybe you have come across the types of necrosis. Here includes, apart from coagulative necrosis, other types of necrosis like mummifactive necrosis, like liquefactive necrosis, and so on. So this is a coagulative necrosis, which is characterized by coagulation of body proteins. Okay. So what are the types of burn? We have a thermal burn, which is usually due to flame, hot liquids and steam, and hot objects, okay? And we have chemical burns, and usually these are due to acidic material or alkalis. And by the way, when we come to talk about alkalis, they do not, fall in this category of coagulative necrosis, because usually alkalis cause it is called as liquefactive necrosis. And liquefactive necrosis is more dangerous than coagulative necrosis, okay? Because it leads to more penetration of the tissues because of this liquefaction. While coagulation, because there is coagulation, there is less penetration of the tissues, okay? Then we have the radiation burn, and it can be due to sunburn and can be due to radiotherapy. And then we have the electrical burns, and this is a special type of burn. We are going to elaborate on all these types of burn in the coming minutes. Pathophysiology, as we have mentioned, the burns affect the skin mainly, and also the airway can be affected on the lung, and it's so-called inhalational injury, when there is inhalation of hot smoke, or the product which, in the smoke, like carbon dioxide and carbon monoxide, and that can cause metabolic poisoning. Carbon monoxide is a very dangerous gas. It is the gas which leads to death in this, fires and burns which happen in closed spaces. So hot gases also can cause physical damage, for example, to the airway and the bronchi, and also can cause chemical alveolitis, and there is also the effect of mechanical blockage of rib movement. All these, contribute to the clinical picture and the patient morbidity and mortality. Pathological effects locally. The burn, there is 3 stages of the burn. There is a stage of destruction. This is immediately after the burn insult. And then after the insult, you have the stage of inflammation, which is a natural response of the body to the burn insult or burn trauma. Then this is characterized by exudation of plasma. And the duration of this stage depends on the extent of the burn and depth of it, and the presence or absence of infection. And it have got some benefit because it's going to help in the separation of the slough and the process of healing. Then you have the last stage of burn, the stage of healing, and that depends on the depth of the burn. Generally, there are some systemic effects like pain. Sometimes the pain is so severe, leading to what is called as neurogenic shock due to severe, overwhelming pain. And then you have the carbon monoxide poisoning, and you have the fluid loss, and you have infection, and you have the mechanical effects. And these generally, effects, pathological effects of the burn, these are the very important, aspect which we need to address when dealing with the burn management. Now, if there is a burn in a certain area, there is 3 zones. The point of maximum damage is called the zone of coagulation, where there is coagulation of proteins, and here there is irreversible tissue loss due to coagulation of the proteins. And then you have the zone of stasis, اللي هي characterized, this is the immediate zone after the zone of coagulation, which is because there is thrombosis of the capillary, of the blood in the capillaries. Usually there is a stasis, less perfusion of the tissues in that area. And then you have the outermost zone, which is the zone of hyperemia. This is characterized by increased perfusion due to vasodilatation, which is a direct effect of the inflammatory response. And here this diagram shows how the burn affects our body. Different systems like cardiovascular can affect the cardiovascular, can increase the capillary permeability, and peripheral and splanchnic circulation اللي هي بيحصل vasoconstriction. And then there is metabolic effect because this is a hypercatabolic state when the patient develops burn. And respiratory system can be affected, intestine, most of the organs are affected by burns. Now we come to talk about the different types of burn. The first and commonest type of burn is the thermal burn, and this is usually caused by flames and hot liquids. Okay, flames scalds اللي هي hot liquids are the most common, and this is we find it in domestic practice. For example, hot tea, hot liquids, milk, and everything is around in your home. Patients can be accidentally, affected by this sudden spillage of hot contents, and this is why it is very common. And we call it scalds. Any liquids which is more than 60 degrees centigrade can cause partial burns, partial thickness burns, and we are going to know what do we mean by partial thickness burns in the coming slides. Now, flames are the second most common and sometimes associated with what is called inhalational injury, which is a very dangerous condition which can lead to the patient death. And in flame injuries, usually because there is production of gases, poisonous gases like carbon monoxide, that is why it is very dangerous. Okay. طيب, let us concentrate here, and this is very important because this is now it is put in the form of points, but usually it comes like a clinical scenario when a patient comes to you. For example, the first class of thermal burns اللي هي superficial partial thickness burns. This is classification of burns, of thermal burns. اللي هي the first one is superficial partial thickness burn. That involves the papillary dermis. You just remember the skin structure. We said that the papillary dermis is a part of the dermis, the outer part of the dermis, which looks like fronds or fingers. It's characterized by papillae. And here, this is characterized by blistering or loss of epidermis. And usually the dermis below looks pink and moist when the patient comes to you. Yani when you go and see the patient, you will find that the dermis looks pink and moist. And if you put your finger, a gloved finger, for example, and press on that area, and then you release your finger, the capillary return will be normal. Yani, it blanches and then the pink color returns quickly. Now, if you do sensation test of sensation, then by pinprick, and this is maintained. This pinprick sensation is maintained intact. It is not affected because the nerve endings have not been affected by the process of burn. So this is the mildest type or class of burns. Okay, and usually healing takes place within 2 weeks and without leaving scars. Okay. This is a picture showing superficial partial thickness burn is affecting very superficial part of the skin اللي هي papillary dermis, and usually this is characteristic, these blisters are characteristic of superficial partial thickness burn. Okay, it takes long time. I don't know why. This is some problem with internet or something. Type. The second type of our class of thermal burn is the deep partial thickness burn, which involves the reticular dermis. That means that we have gone a little bit deeper. A damage is a little bit deeper. It is already gone through the papillary dermis and affected the reticular dermis. So a patient, when you come and see the burn area in this patient, you not see it as moist as in case of superficial partial thickness burn. And there is abundant capillary staining due to thrombosis of blood inside the capillaries. Okay? Absent capillary blanching for the same reason, because the capillaries, the blood in the capillaries gets thrombosed, and that is why there is absence of the capillary blanching or capillary return. And here, because the reticular dermis is affected and where the places of the nerve endings, so the sensation is usually reduced, although the damage is more. Yani this class, a patient, when he comes, he will be, is in less pain, and that is not a good sign, because that means there is more damage to the skin and the nerve endings. Okay? And here healing usually results in hypertrophic scarring and takes more than 3 weeks to complete. Now we have the third class of burns, اللي هو deep full thickness burn, and usually here there is complete destruction of the dermis, both papillary and reticular dermis. And when you see the patient, you will see the skin looking very hard and leathery, have a leathery feel. Leathery means like leather, اللي هو الجلد المدبوق. Okay, and there is complete absence of capillary return, and there is thrombosis below the skin, and complete absence of sensation. So if you have a patient with this clinical picture, that means this patient is in severe type of pain, okay, in spite of the fact that he's not feeling pain at all. Okay, so the patient who feels much pain have got less degree of damage, okay? And the patient who doesn't feel any pain, there is complete absence of sensation, that means this patient have got the most severe type of thermal burn. I don't know why it's taking a look. Yeah, this slide you might have heard about حروق من الدرجة الأولى، من الدرجة الثانية، من الدرجة الثالثة وهكذا. Just this picture shows this idea that first degree burn, and this is a very superficial, just hyperemia affecting the epidermis only, okay? And then you have a superficial اللي هي second degree, it affects like this papillary dermis. زي واضح يا جماعة أنها هي affecting the papillary dermis. This is second degree burn. So superficial partial thickness burn اللي هي في الكلاسيفيكيشن اللي قلناه قبل شوية includes first and second degree burn في الكلاسيفيكيشن ده. تمام. and then you have a third degree burn, okay, which here the damage reaches the uh, the damage reaches the subcutaneous tissue, okay, and here this is coincides with a deep full thickness burn, okay, because the whole dermis is affected, okay. And there is another class which is called fourth degree burn, when the muscles is affected, the burn reaching damaging the whole skin thickness and subcutaneous tissue and reaching the muscle. This is called fourth degree burn. But this classification, it doesn't have got any clinical importance. The most important classification is the first classification, which is the one we mentioned before, okay, that have got clinical impact and used to help the management in case in burn units. طيب, there is another classification that depends on the extent of burn, اللي هي المساحة من الجلد اللي هي صار فيها الحريق. And here the burns are classified into minor burns and major burns. If you have less than 10% of the body surface area affected by the burn in children, or less than 15% in adults, we call that minor burns. And if you have more than 10% of the body surface area or more than 15% in adults, we call that major burns. And this classification is also important because we use it to decide whether to admit the patient or to discharge him, or to give fluid or not to give fluid resuscitation for the patient. So we have two classifications which are related to the management. The first classification into the depths, and the second classification which depends on the extent of the burn. طيب, clinically we need to consider the age of the patient in assessing the patient who is affected by burn, and the psychiatric and social background, because there are some decision in the management which depends on this information. For example, if somebody have got some psychiatric problem and you suspect that this patient is having some problem and he is the one who inflicted this burn on himself, even if the burn is minor, you have to admit this patient because you know that he is not safe person. A social background, somebody who have got no one to take care after him, also needs to be considered when talking about management. Then the depth of the burn, of course, you have to assess it to classify the patient into that the previous three categories, and extend to also classify the patient into minor or major burn. And then you have to make sure whether this patient have got a inhalational injury or not, because this is also important in the decision in the management. And you have to consider whether the patient, whether the patient have got chronic medical disease or not, and associated injuries, because one of the things which we have to look for when assessing a patient with burn اللي هي associated injuries. لأنه usually if a fire catches somebody close, usually people tend to run, or someone who is living, for example, in the third floor is going to try to jump and escape the fire. So it's quite possible that the patient will have some other injuries. So that needs to be considered during the assessment of the patient. طيب, how we assess the extent of the burn? We have two rules اللي هي هذه. This one is called Wallace rule of nines. This is used for the assessment of body surface area. It divides the body parts into areas of 9%, 9%, or half of it, for example, 4.5%. And you go and add the areas of the burn. For example, if this patient have got burn which is affecting the whole chest, اللي هو constitutes about 9%, and also the whole abdomen, that constitutes also 9%, means that he have got a total body surface area which is affected by burn about 18% of his total body surface area. And if you add, for example, the perineum is given 1% here, that means he have got a burn of 19%. And why this is important, Jama'a? Because we are going to decide the fluid resuscitation, the amount of fluid which the patient needs according to the area affected by the burn. Then we have the other formula. This is called L1-Browder chart. By the way, and the previous rule, this one, Wallace rule of 9, is suitable only for adults. It's not suitable for children. Okay, this applies to adults only. طيب, L1-Browder chart, this is applicable to all age groups, including children from first day of life up to adults. And here it takes it considers the proportion of the body according to different age. See here, the head at birth, اللي هو age 0, constitutes about 9% of the total body surface area, while in adults it constitutes only 3%. Okay? And you have A for the head, B for the thigh, and C for the legs. And then you have the different parts of the body. اللي هي torso here, for example, torso here, the anterior aspect of the torso, اللي هو including the chest and abdomen, it constitutes about 13%. The back also constitutes about 13%. So you are going to add all these things, okay, together, and according to the age. Here you adjust it for the A for the head, B for the side, and C for the legs, because the proportions are different according to age. طيب, the burn management includes this pre-hospital care. Usually you ensure safety, of course, safety of the patient and safety for yourself as a rescuer. انت حتى إذا كنت around and you want to rescue the patient, you have to consider yourself, because if there is a fire that can catch you, you do not try, because it's going to be dangerous to your life also. So they're very important and to ensure safety. And the number 2 is to stop the burning process, اللي هي يا جماعة بنعمل حاجة اسمها stop, drop and roll, اللي هي patient, usually if the patient, you find the patient running and catching the fire on his clothes, the fire is you have to stop him, not by grabbing him. You can just try to stop him, for example, tackle him down and then drop him on the ground and roll him. And this is the most efficient way of stopping the fire on the patient. And then the ABC, اللي هي airway, breathing and circulation should be followed by the secondary survey. And we have to cool the burn wound but avoid hypothermia. يعني don't put fluid from the icy fluid, يعني very cold fluids. Is about around 15%, more than 15% is good for a minimum of 10 minutes. Oxygen also is important to be given, especially if there is an ambulance. خلاص جاء المريض جات ambulance وكده they are going to put oxygen for him. طيب hospital care, here these are the indications for admission if the patient. If you suspect inhalational injury, then you have to admit the patient. And if the patient have got major pain, that means more than 15% of body surface area in adults, or more than 10% in children. This is also indication for admission. And pains affecting areas of major functional importance, like the face, hands, feet, major joints, and perineum. Okay. طيب any pain that requires surgery اللي هي deep burns in extreme of age, very young patients, children at very young age, or old and frail individuals. Okay. Suspected non-accidental injury, if somebody brought some patient or any patient who is affected by pain, and then during your assessment you feel that this might be not accidental, يعني ما هي صدفة، ممكن شخص هو اللي سبب له الكلام هذا, then your duty is to admit this patient so as to protect him from any future or injury. Okay. طيب poor psychiatric and social background, هذا الكلام قلناه انه is very important انه to consider as indication for admission, or associated injuries like arrhythmias, and this is one of the problems in cases of electrical burns اللي هي الاريزمياس اللي هي abnormal heart rhythm. Okay. And fractures, etc. All these associated injury are indication for admission. طيب for minor pains, only we need to give the patient a pain control and sedation, and locally we take care of the wound by puncturing the vesicles and remove the raised epidermis, and we apply local antibacterial creams, and usually this is silver sulfadiazide. Usually you see here the most important thing is there is no antibiotic here in the management of minor pains. يعني الناس اللي يجيك مريض عنده حاجات خفيفة بالطوارئ لا تعطيه antibiotic لأنه ما it's not indicated in this case. Okay. You just give these three things. طيب for major pains, أول حاجة we hospitalize the patient in a burn center. That is the most ideal thing, and the patient receive treatment in the burn center. If you do not have burn center, then you have to admit the patient in the surgical department in the hospital. And airway and breathing should be maintained, and early endotracheal intubation is in suspected airway injury, لأنه if you delay the endotracheal intubation, the patient will develop laryngeal edema, and it will be very difficult for you to insert the endotracheal tube. Okay. And you have to insert peripheral IV line for fluid resuscitation, and you put an indwelling urinary catheter, and this is important for monitoring the urine output because it reflects, the adequacy of resuscitation, and then you need to replace the fluids deficit and control the pain using usually opiates like morphine and pethidine. Anti-tetanic serum and anti-gas gangrene are given, antacids also, and this is to guard against stress ulcers, which is common with burns. Okay, enteral nutrition very important, اللي هي through the GIT. Okay, and systemic antibiotics indicated only when there is evidence of infection. Yeah, in the absence of evidence of infection, you do not give systemic antibiotics. طيب fluid therapy. The fluid therapy indicated if in major burns، يعني أكثر من 10% في الأطفال وأكثر من 15% في الادults. And usually we use some standard formulae to calculate the deficit of يعني الفلويد needed. طيب we can give either crystalloid اللي هي يا جماعة low molecular weight fluids like Hartmann solution, hypertonic saline, or even normal saline, or we can give colloids اللي هي the high molecular weight fluids like human albumin, like fresh frozen plasma, like حاجة تانية اسمها starch. All this can be used. لكن you have to consider the formula which is used to calculate the fluid deficit in according to the choice of your fluid, whether it is crystalloid or colloid. So Barkeland's formula is used for crystalloids اللي هي body surface area percentage multiplied by the body weight multiplied by 4, and this is going to give us the deficit in the 24 hours. In 24 hours يعني this fluid should be replaced within 24 hours. طيب من متى نحسب يا جماعة half of this fluid is given in the first 8 hours and the rest is given in the next 16 hours. طيب من متى نحسب ال8 ساعات الأولى؟ هنحسبها من وقت المريض، وقت إصابة المريض والحاجة، from the time the patient was affected by burn, not from the time when the patient arrived to the hospital. اوكي؟ يعني حساب ال8 ساعات الأولى يكون من وقت الحرق مش من وقت وصول المريض المستشفى. So if the patient comes after 2 hours to the hospital, that means we are going to give the first half in 6 hours, not in 8 hours. Okay, over 6 hours. مفهوم يا جماعة؟ Clear so far? Okay. طيب. The other formula which is used for the colloids is called Muir's and Barkley formula. And this Muir and Barkley formula is used for calculation of the fluid deficit which you want to replace with colloids like human albumin or fresh frozen plasma. Okay? And here we multiply 0.5 by the body surface area and body weight. And this is going to give us what is called portion. One portion. It's not the total fluid deficit in 24 hours like the previous formula. Okay? Portion means juzu. يعني we have to give 3 portions in the first 12 hours. يعني first portion in the first hour, 4 hours, and then the second portion in the second 4 hours, and the third portion in the third 4 hours. And then you have to give another 2 portions over 12 hours, and the other 2 portions over 24 hours. So you have a total of here 12 plus 12, 24, and then you have here also 24. This is 48 hours. So the total deficit you are going to replace in the first 48 hours from the time of the burn we sustained. And urine output, you make sure that urine output is about 0.5 to 1 mil per kg per hour. That means you have adequate fluid resuscitation. A portion we calculate the portion by this formula. يعني say انه يا جماعه كان السيرفيس اريا which is affected كانت 10%، تمام، ووزن المريض 60، تمام. طيب هنضرب 0.5 في 10 هتدينا كم؟ هتدينا 5. هنضربها في 60. 5 في 60 هتدينا كم؟ 300 صح؟ 300 مل. This is one portion. طيب هنديه كيف؟ هنديه 300 مللي في الأربع ساعات الأولى، وبعدين 300 مللي في الأربع ساعات الثانية، وبعدين 300 مللي في الأربع ساعات الثالثة. That means we have to give 900 ml in the first 12 hours. And then we give him our 300 ml the next 6 hours. بعدين 300 تاني في النكست بعدها. That means 600 مللي هنا. And here also 600 ml. So a patient ultimately we will take here 900 plus 600. This is 1500, and then plus 600 is going to take about a total of 2 liters. 2 liters and 100 ml. Okay, مفهوم؟ طيب عجباكم اي اوكي. Then we have to go to the burn wound care اللي هي هنا يا جماعه we do debridement and cleaning, and we do what is called emergency sclerotony for circumferential burns اللي هي burns which is all around the body, okay, in the chest for example, or for example in a limb, because we do sclerotomy. We will show you the picture of sclerotomy in the coming slides. And for full thickness burns and deep partial thickness burns are dressed usually with antibacterial dressing. Deep partial thickness burns need tangential shaving اللي هي you have to shave the skin which is affected and apply split skin graft. And superficial partial thickness burns are either treated by the exposure method يعني تخليها مفتوحة للهواء عشان تنشف، ولا you use a permeable dressing. okay, كل method له advantage and disadvantage. طيب full thickness burns need full thickness excision of skin and skin graft. This is what is called sclerotomy اللي هي الفتحات هذه في السكين والسبكيوتينس tissue عشان to improve the respiration and breathing حق المريض هذا، لأنه he cannot breathe with this circumferential burn because of the severe pain. Chest will be very tight and patient will not be able to have adequate breathing. So this is what is called sclerotomy. Okay, sclerotomy في ال previous slide هتلاقوها. Okay. Here also this is sclerotomy in a patient. This is a patient have got electrical burn, and usually electrical burn are classified as deep burns. Okay. And here to avoid what's called compartment syndrome لأنه بيكون في دمج جوا للمسلز. Unless you release the fascia and the skin, the patient is not going to develop gangrene of the whole limb. The compartment syndrome. طيب here this is the two types of dressing اللي هي exposure method. Patient left exposed isolated in aseptic atmosphere محل يكون معقمة, and nursed in mosquito net بنغطيه بالناموسية خلاص, و usually used في الhead and neck and perineal burns. ليش يا جماعة؟ because it's very difficult to apply dressing in these areas, so that is the best thing, and to leave them open exposed, isolate the patient in aseptic atmosphere, and try to put him in the mosquito net to avoid the flies and things from the insects and these things. طيب in the occlusive method there is bulky dressing here, usually change every 3 days, used in circumferential burns and limbs and minor burns. And here this is the main advantage of this is going to decrease the fluid loss and pain. Okay. Okay, now we come talk about one important aspect of burn اللي هي الفلام burns اللي هو الانهيليشن injury. And you remember it's about a few years ago كان في حريق في مستشفى الجزائر العام، وكان معظم الضحايا يا جماعه منهم سبب اللي ماتوا ما ماتوا بالحرق المباشر، ماتوا بالانهيليشن الانجري اللي هي usually because الاختناق اللي هو يسموه الاختناق الناس. So this is caused by the effect of hot steam and soot particles. Soot particles اللي هي ال الحبيبات الدقيقة جدا جدا اللي بتطلع من الدخان بتاع الأشياء. So these are called the soot particles. The black is carbon, is usually carbon. This is leads to airway edema and chemical pneumonitis. Okay, and this chemical pneumonitis later on can develop into bacterial pneumonia. And usually symptoms that makes you suspect inhalation injury. For example, from the start, if the patient have got from the history there is a burn in a confined space like in a car or in a house, then you have to suspect inhalation injury. If the patient voice is hoarse, there is hoarseness of voice, or there is some blisters in the hard palate, and burns around the mouth, and bare nasal mucosa and all nasal hair, presence of soot in the nose or pharynx, or sometimes the patient comes spitting in the sputum, the soot نفسه الأسود هذا. All this it makes you to suspect inhalation injury. Besides the increased respiratory rate or decreased oxygen saturation or stridor. Stridor اللي هو يا جماعة inspiratory sound. This is very late sign. This denotes this patient have got laryngeal edema, which is a dangerous condition. Septisternal recession. This is a sign of respiratory distress. And if you do an X-ray, you can find some patchy consolidation in the chest X-ray. Okay? طيب. Treatment here, we have to secure the airway, usually with endotracheal tube or sometimes cricothyroidotomy اللي هي needle نحطها في the cricothyroid membrane في التراكية. إذا كان it's not easy to put the endotracheal tube. And usually we give humidified oxygen and nebulizer. This is just picture showing, this is bare nasal hair, mustache also is bare. There are some blisters around the mouth and the hard palate. All these are signs of inhalation injury. نيجي نتكلم عن electrical burns اللي هي types either from low voltage or high voltage. Low voltage here usually in domestic powers like in the house or in any place اللي هي الهوسبيتالز or المحلات اللي احنا نمشي عليها وكده. Here usually cause small deep burns. البان بيكون الاكستنت حقها small لكن it is classified as deep because there is entry. التيار بيخش بمكان وبيخرج بمكان. بيكون في two wounds, entry wound and exit wound, and in between there is damage of the tissues. And here this can cause cardiac arrest, okay, but no myocardial damage, okay. Can cause also tendon and nerve injury. High voltage burns اللي هي cause damage by the flash اللي هي ده تلاقيها انه في اللي هي الهاي فولتج الماكينه الضغط العالي هذه الواحد ما يقرب لها لانها it can take you without touching it يعني لانه يحصل حاجه اسمها الارك زي البرق او الصواقع. طيب can cause damage to subcutaneous tissue and muscle اللي هي fourth degree burn اللي قلناها leading to compartment syndrome and myoglobinuria اللي هي a condition which can lead to renal failure. And here can cause myocardial damage. So the damage here is irreversible, while the damage here is reversible in case of low voltage burns. طيب نيجي للchemical burns اللي هي caused by corrosives and acids usually lead to deep localized burns. لكن الالكاليز are more dangerous than acids because it leads to deeper penetration because they cause liquefactive necrosis as we have mentioned previously. And here local irrigation with plain water reduces the damage. So the ultimate damage is after full assessment of the patient after some time. You have to know what the full extent of damage so that you can deal with it. طيب radiation burns اللي هي is either localized or involving whole body. Okay, a treatment is conservative until the extent of the damage. Usually it's very difficult to assess initially, but you need to wait for some time so that you can know the extent of the damage and then you deal with it. Radiation ulcers should be excised and grafted. Radiation can cause systemic effects, of course, and for example, GIT and immune system can be affected. طيب, these are the list of investigations. You need to go through it, which we need to do in assessing a patient with burns. And here we have this. These are the complications of burns. You know, the general complications include asphyxia, shock, which can be neurogenic, hypovolemic or septic shock, because the patient واحدة من complications بتاعت البرن إن the patient can develop infection and septicemia. So it can go into septic shock. Electrolyte imbalance because of fluid loss, renal failure, as we have mentioned previously, that either renal failure either due to a shock اللي هي الhypotension or due to the, for example, in cases of electrical burn due to myoglobin urea, which is the result of damage to the skin, to the muscles, sorry. طيب, gastric ulcerations also, this is, we mentioned stress ulcers develop in cases of burns, paralytic ileus, malnutrition, multi-organ failure. This is, all these can happen in a patient with burn. Locally, we have infection. It can either involving the skin, respiratory tract, or urinary tract infection. Gangrene in cases of electrical burns اللي هي بتكون عندنا deep burns and damage and thrombosis of the vessels, and hypertrophic scars and deformities, margarine ulcers, we are going to see example, and lymphedema. Here, this is a gangrene due to electrical burn in a patient. You see the whole toe become gangrenous and black. Here, this is hypertrophic scars and keloid formation like this in the, see, you can just imagine the difficulty of this patient in dealing with normal life activities like eating, for example. Okay. Here, this is margarine ulcers. That means malignant transformation of the ulcer in a case of chronic burn scar. Here, this usually is the periphery here. This area where there is overgrowth, this is tend to malignant, usually squamous cell carcinoma. Okay. Here, this is just example. You can go through it to show you the way of how to calculate the fluid replacement in a patient. Okay. And this is the last slide. If you have any question, we just have 5 minutes to deal with it. Okay. Investigation by X-ray. احنا ما قلنا يعني X-ray, you need the X-ray for many things. For example, in the chest X-ray, if you want to see the patchy consolidation in cases of lung affection of the lung, or if there is associated injury, for example, a patient who developed fracture of the spine while he's trying to jump from for example, one high floor or high building. So you need to do these X-rays to assess associated injuries. And chest X-ray is very important, for example, in the assessment of inhalational injury. Clear? Any other question? المثال okay, we'll go back to the المثال. Here قال لك you see a patient who sustained second degree burns, okay, 2 hours prior to coming to your ER. He weighs 70 kg and has 20% total body surface area burn. تمام. المريض وزنه 70 كيلو والبيرن الاكستنت البيرن حقه 20%. طيب هنيجي نضرب، احنا we are using Barkland formula 70 اللي هي الويت بتاع المريض في البرسنتج بتاعت البيرن اللي هي 20%، نضربها في 4 سي سي بير كي جي. طيب هيعطينا الرقم هذا اللي هو 5600 لتر ملي لتر مل it's not liter mil or 5.6 liters. Okay. طيب now remembering that he gets half of this in the first 8 hours and half in the next 16 hours, you calculate he will need 2 boluses, each one of them being 5600 على 2 اللي هي بتديك 2800. خلاص. طيب since 2 hours of the first 8 hours has already passed from the initial injury, he will need to get the first bolus over 6 hours. عشان كده احنا قلنا احنا نتحاسب الزمن من وقت الحريق مش من وقت وصوله للمستشفى. تمام. يعني هنديه ال 2800 في ايش في over 6 hours. طيب ال 2800 over 6 hours هتدينا ايش؟ هنقسمها على 6 هتدينا 467 سي سي بير اور. طيب additional fluid given over the next 6 hours. تمام. طيب طبعا هذا الفلويد ديفيسيت. It's not the daily requirements. You have to add the daily requirements عشان تؤاد الكلام هذا. يعني البيشنت ما هتخليه صايم هتديه فلويد ريبليسمنت الديلي ريكويرمنت حقه. طيب now the remaining 2800 would have to be administered over the next 16 hours. يعني 2800 على 16 بديك 175 في الساعة. additional fluid also given over it. طيب this is in addition to his maintenance fluid اللي هي maintenance which is for 70 kg would be 104 cc per kg. So his final orders would be like that. هتعمل تضيف ال daily requirements يعني ال 467 تضيف لها ال 104 تطلع 571 per hour for the first 6 hours. And for the next 16 hours you add 175 اللي هي الفلويد deficit plus 104 this is the maintenance هيديك 279 cc per hour for the following 16 hours. Clear? وعلي محمد عباس قال كلام مهم. if the rescuer tackles and rolls the burn victim. طبعا في potential risk لكن هذه اخف الريسك. يعني انت احسن مما تمسك الشخص اللي هو قاعد مشتعله فيه النار. you hug him, you catch him by hugging. لا افضل انك to tackle him and to roll him and make sure that you do not catch the fire. اوكي as a rescuer. يعني انت كمسعف تاكد انك انت برضو سليم في السليم يعني. اوكي لكن this is the safest way انك you tackle the patient and roll him to extinguish the fire on him. Okay. Any other question? أي سؤال يا جماعة؟ Yeah. Then I will just have to roll him. Yes. Only roll. Don't catch patient. Don't hug him. Or if you have a blanket, for example, عندك حاجة معاك عندك مثلا جاكيت تقيل تقدر ايش تحطه على المريض عشان تطفي النار حواليه من فوقه يعني. اوكي. مفهوم يا شباب؟